Everyone for tuning in to our Future Health Symposium. It's our pleasure to be here today to share about powering sustainable health innovation. Before we begin, I'd like to do a quick introduction about ourselves. We are from the Smart Health Leadership Center and we come from very diverse backgrounds. One binding factor that brought all of us together is that we come from the healthcare industry, but in different domains. Hi, I'm Bethia. In my past life, I dabbled with healthcare operations management, corporate development, and communications. I drive outcomes through improving clinical workflows, resolving system wide issues, and am part of the crisis management team during major healthcare incidents. With me, I have Kim and Meng Yuan. Kim, would you like to tell us more about yourself?
Yes, thank you, Bettia. Yes, during my professional experience, I had led and contributed to organizational transformation success. So, when I was with health tech organizations, my role is to help companies in both public and private sector to adapt and embrace digital transformation. How about you, Meng Yuan?
Thank you, Kim. Hi, I'm Meng Yuan. I had worked in the hospital as a staff nurse for years. My working experience in clinical setting makes me feel very excited to today's topic, health innovation, as I had encountered some in my workplace and would like to look forward more to come.
Thank you, Kim and Meng Yuan. Now let us dive straight in. Before we begin, let's address what is health innovation. To me, health innovation is any development, be it big or small, simple or complex, that improves health outcomes and patient experiences. So we ask ourselves, why do we need to innovate? There's a plethora of reasons why industry, particularly the healthcare industry, need to innovate, but I will distill to these three main reasons. First of all, it's the aging population that all of us are very familiar with. Statistics from MOH show us that by 2030, 1 in 4 people in Singapore will be aged over 65. As we age, we tend to have more healthcare needs. Those pesky chronic illnesses will start finding their way to us. Although the demand increased significantly, our health manpower doesn't increase correspondingly, and hence we will face a huge burden on the healthcare system. Therefore, it serves the need to look for alternate ways to handle these issues brought about by an aging population and hence the need for innovation. Now, the next reason why we want to innovate is because we have a rising operational costs. And one of the major contributing factors is rising labor costs. And this unprecedented pandemic has forced us to pivot and adapt to the volatile environment constantly. Many have suffered physically and psychologically from undue stress, resulting in a burnout. Our frontline staff were especially at the brunt of it. As such, we see many people pulling the brakes and reevaluating their priorities. Some say that he has attributed to the Great Resignation wave. One thing for sure, it has certainly exacerbated the dire manpower crunch situation. Now, in healthcare, we're talking about skilled workers, and training them is expensive. This high turnover is not only disruptive, but also costly to the healthcare system. So apart from that, globally, we are seeing an inflation trend. Our medication costs, fuel costs, and all other administrative costs are all going up. And this drives the overall operational costs higher. Therefore, we need to double down on boosting productivity and optimizing labor, and that is where innovation comes to play. The third reason why we need to innovate is because of technological advances, which is rendering some processes obsolete. So as people and technology becomes more interconnected, some of these processes become legacy processes and no longer make sense in today's world. So, for example, we used to rely on porters to deliver medical records from the ward from the medical record office to the ward or the clinic. But with digitalization of medical records, such workflows becomes redundant. And similarly, we see an increase in the deployment of machines for patient to self-help, say, for instance, self-registration and self-payment kiosks, as well as Health Hub, which can help us to retrieve medical records and prescription, etc. So with these technological advances, it changes the way we interact and hence the need to change the way we work. Now that we know why we need to innovate, so Kim, why is sustainable health innovation?
Good question. Let me give you a quick examples, particularly during the outbreak. Now, all of us know that COVID-19 pandemic tested the global health system resilience like never before. And the pandemic has caused an immense impact to our healthcare system, and the surge of demands for medical supplies, ventilators, medical consumables led to a massive global shortfall that jeopardized millions of lives. Singapore has not been spared. That's the reason why it is important to build resilient and sustainable health system. Now, Singapore was one of the first country to respond to the COVID-19 situation through the technology innovation. A very good example is the COVID-19 Community Care Facility, CCF, set up in Expo. Now, CCF was actually equipped with telehealth on wheels, remote vital signs monitoring, and many more. The purpose is actually to free up hospital capacity and at the same time to provide urgent medical care for our COVID-19 patients. Now, CCF was actually set up with integrated system, health discovery, which is a real-time dashboard for healthcare professionals to manage patients more effectively. Now, these innovations has reduced the healthcare professional workloads and allow them to focus on urgent tasks. How? The patients in CCF are actually empowered to take and submit their own vital signs through an app. The third example is the command, control, and communication C3 system is another COVID-19 innovation co-developed by TTSH and IHIS. Their system helps to facilitate day-to-day operations in hospitals by providing real-time visibility on patient flow, inventory, staff development, and many more. Now, Mengyuan, would you like to share with us how is healthcare innovations different from other types of innovation?
Sure. But before we talk about the differences, we need to understand what is innovation. Innovation defined as the act or process of introducing new ideas, device, or method. And in many organizations, it also usually regarded as novel technologies and changes in business models. However, one thing we must be clear is that innovation is not invention, which when we say we innovate something means that the idea or action is successfully scaled and be broadly about to transform. To innovate is to go beyond and exceed the expectations of stakeholders and the market. Innovation can happen in different fields. For health innovation, it defined as new or improved health policies, practice, system, products, and technology, service and delivery methods that result in improved health. WHO also explained that health innovation improves the efficiency, effectiveness, quality, sustainability, safety, and affordability of healthcare. However, health is so complex. Different from innovation in other fields, health innovation cannot be explained in only one type of innovation. Unlike what most people think, it should not be seen simply from a technology-centered perspective. Health innovation cannot be guided only by market. It should aim to generate different forms of value, not only economic. It should also involve social innovation, and it becomes more and more important to shift to it as the end goal is to improve the well-being and the quality of life of individuals and communities. Moreover, unlike innovation in other fields, clinical trials are always required when doing innovation in health. Randomization in clinical trials helps to reduce bias and provides a rigorous tool to examine cause-effect relationships between an intervention and outcome. Participants and all other involved researchers are often needed to be blinded to what treatment they receive. However, there are barriers in doing the trials. One cause is that not enough patients enter the trials. Giving the example of patients diagnosed with cancer, no number of patients agree to be involved. For many of them, treatment is a one-shot chance, and they just want to take the option recommended by their doctors. Limited evidence-based medicine and premature adoption of therapies also restrain the conduction of clinical trials, such as our current COVID-19 vaccine were not tested in pregnant women in the initial clinical trials.
We have seen the reasons why we need to do health innovation, and Kim has also shared with us the compelling reason why it has to be sustainable. And Meng Yuan has just shared with us and how health innovation is different from other types of innovation. So let us share a few real life examples of health innovation in our areas of specialty. Kim, would you like to keep us off with health innovation in technology and digitalization?
Sure. Thank you, Betty. Yes, talking about health innovations in terms of technologies. Now, today we are at the fourth industrial revolution, a phase that focuses on interconnectivity, smart autonomous system powered by data and machine learning. Yet in healthcare, we are significantly behind other industries. We are still focusing on providing reactive care instead of prevention of diseases. Now, we all agree that healthcare is undergoing transformation. That's a given fact. But why is that so? Because we are dealing with aging population, as mentioned by Betty earlier, that tends to have higher prevalence of expensive, lifelong chronic conditions. Now, let's just be real here. Technologies exist and the new technologies has emerged. The advancement of science has been moving towards decentralizations of care delivery models to bend the cost curve. Now, this is really exciting. We all knew that the technology is an enabler. Digital transformation is essential to democratizing the healthcare system. Interestingly, COVID-19 has accelerated the digital transformation in healthcare industry, driving organization change, forcing leaders and medical professionals to move faster, work smarter, and even prompting them to develop a new business models focusing on outcome-based and value-based healthcare system. However, the implementations of the technologies leads us to another complex challenges, which we will discuss later, which is preserving the privacy and security. Now, as healthcare ecosystems evolve, we will continue to witness continuous technology enabled innovations. Now, let's take a look at this IoT. What's more interesting is that we are in an interconnected world, as explained earlier. The Internet of Things, IoT, is a network of devices connected with sensors, processing ability to collect and exchange data with other devices in the ecosystem over the Internet and other communications in the networks without involving a human being. IoT actually helps us to live and work smarter by able to gain complete control over our lives. Now, capitalizing on the power of IoT, we're able to shift from reactive to proactive patient care beyond hospital to community. As mentioned earlier, medical devices, wearable devices, smartphones, and applications can be used as a tracking and monitoring system. But how about get your next eye exam on a smartphone? Peak Vision app was actually developed by eye experts that allow anyone in the community settings to measure clinical validated visual acuity tests using smartphone. Now remember, the app is not intended to replace detailed examinations, but actually to screen and identify those who need the further examinations. We're going to the next technology, big data. Remember, as all the medical devices, wearable devices, smartphones are embedded with sensors that have been used as a tracking and monitoring system, it actually generates enormous amount of data. Now, big data is helping to make sense and offers insights from massive amounts of real data collected by IoT devices. Now, big data algorithm can help to define, fine-tune the prevention protocol to significantly reduce the burden of the healthcare system. With the recent COVID-19 pandemic, we should realize that the infectious diseases aren't going anywhere. So, to protect the global population health, there is a need for the next generations of vaccine in order to eradicate infectious diseases. Base Immune, a London based biotech startup, is actually using big data and deep learning algorithm that integrates genomic, epidemiological, immunological, clinical, and evolutionary data to devise method for antigen design discovery. These help to develop future-proofed next generations of vaccines where the new antigen is drawn from the entire pathogen instead of a single protein, which remains the key barriers in the vaccine development today. Now, the next one we will be talking about is AI. This is really interesting. Driven by the demographic change, AI technologies have the potential to address aging populations' needs. Now, what is AI? Artificial intelligence is actually refers to simulations of the human intelligence that are programmed to think like humans, perform human-like tasks. This disruptive technology has the ability to increase the ability for healthcare professionals to discover key areas of improvement in the healthcare ecosystem. For example, AI in medical imaging able to assist the physician speed up the diagnosis processes. Predictive analytics fueled by AI and machine learning can help clinicians in deciding best clinical treatment for our patients by anticipating future events. So, Mengyuan, how is your experience of health innovation in clinical and patient safety?
Thank you, Kim. Well, the end goal of innovation is to benefit the patients and the receiver of care. When we talk about patients, most of us will first think about clinical settings or clinical care. And in clinical care, health innovation is often linked with therapeutic and medical advancements, such as rapid diagnostic tests, new drugs, and vaccines, which we get familiar during COVID-19. Today, I will list out other examples. Firstly, is digital health record. It is an online summary of one's health information that is shareable with your doctors, hospitals, and other healthcare providers. The purpose is to ensure better access to healthcare information at any time and anywhere. The common type includes electronic medical record or EMR, electronic hospital record or EHR, and personal health record or PHR. EMR and EHR are usually used by healthcare professionals in the healthcare institute. And PHR is more for personal use, which most of the data gathered from fitness or wellness device. It's very common for us to visit multiple healthcare providers in our lifetime, such as different GP, polyclinics, clinics, and hospitals. As a result, each of these providers will have some parts of our healthcare history. With digital health record, the healthcare professionals will have a holistic picture of our history. With one patient, one health record, the care team could provide safer, better, and more personalized care. For EMR and EHR, it provides accurate, up-to-date, and complete patient's information. It has quick access. Time and clicks are the most common barriers our doctors are facing now. With EMR and EHR, doctors can just input what they want, and then they will get rapid answers from a trusted database. It also improves safety and quality of care and has reduced medical errors. It enhances privacy and security of our patient data as well as reduced cost through decreased paperwork and reduced duplication of tests. Another example here is telemedicine. It is remote communication or monitoring between a patient and a clinical service using technologies. And sometimes it also can be used when doctors interact with other healthcare professionals, providers, and caregivers virtually. It links with a digital health record. Telemedicine is comfort and convenient. Patients can see a doctor without waiting for an appointment. They can just consult at the comfort of their house. Doctors can use it to pre-screen patients so to better control of infectious illness, and it can protect the vulnerable populations too. It provides better assessment as it streamlines workflows and allows them to monitor patients in real time and adjust treatment plans when necessary. It's also a good way for family connection and better management of primary care and chronic conditions. However, some factors we need to consider, such as technical and financial factors, which could affect the success of uptake of telemedicine. Last example here is one of the projects I had involved with, which is intelligent stroke rehabilitation system. In Singapore, stroke became the fourth leading cause of death. Patients with stroke often experience impairments in motor, sensory, and cognitive functions, which result in difficulties improving their activities of daily living or ADLs. Rehab provides opportunities for them to improve the ability to perform ADLs. This project provides automated home-based rehab system. It helps to monitor, track, and improve the fundamental skills of the stroke survivors. It also can reduce the workload for our therapists. The system uses an infrared camera system with machine intelligence software. It is portable and easy to set up. It's also contactless, so our stroke survivors will not feel any discomfort on their limbs. It mainly contains two parts, exercise and game, which gamification could motivate stroke survivors to perform and continue their rehab. The program flow is automated by using decision tree to be more personalized. The number of exercise and the difficulty of the game are different in individuals. Moreover, both user and therapists can track the progress and the result. In addition, we also have done clinical trials. There were total 45 stroke survivors from stroke support station complete our trials, and it showed impressive results. So, Bertia, how about health innovation in operations?
Thank you, Meng Yuan. So, health innovation in operation doesn't always call for new invention or a bombastic discovery that requires some kind of overhaul. So, more often than not, it requires a thoughtful implementation of modified processes that will improve health outcomes and patient experiences. So, let's look at health innovation in operations from three broad angles. First up, it's workforce transformation. My first example is one that emerged during the pandemic. I'm sure we recall during the initial peak of the pandemic waves, flights were cancelled and we're not allowed to travel overseas. Our cabin crew had to be temporarily grounded. So the SIA and KDPH signed a MOU called the Care Ambassador Program. This allowed the SIA crew who are temporarily grounded due to cancelled flights to be seconded to public hospitals. Now, this arrangement has helped to augment the pressing manpower needs brought on by COVID-19 outbreak. The care ambassadors were taught basic medical terminologies, vital signs monitoring, oral feeding, as well as how to position and turn a patient. So once they've undergone training, the care ambassadors are now ready to support the hospital care teams to carry out duties such as providing basic care, admission counseling, nutritional care, as well as patient management for patients in the low-risk ward. In this way, it frees up the nurses to focus on providing clinical care to the patients. Now, this is not a stopgap measure. The success of this program inspired KTPH to create a new role called the Patient Care Officer. And this role further supports the clinical work of the nurses and allows our hospital to provide better end-to-end care for patients. So in this case, we see innovation by means of clever use of resources and the agility of the hospital to transform their workforce to meet the demand. Now, in the next example, we will see health innovation demonstrated in a form of care redesign, where we go against the traditional way of how care is offered in a hospital. So, if you recall last year, sometime between September and December, Singapore experienced a surge in the COVID-19 cases, which result in an increase in the hospital bed occupancy nationwide. So at that time, NUHS was already taking care of non-COVID-19 patients at home via a program called the NUHS at Home program. They saw the opportunity to provide similar model of care for COVID-19 patients at home. Hence, virtual ward is birthed. So by allowing this COVID-19 patient who wish to and are able to recuperate at home, stay out of the hospital, it serves to also increase the hospital bed capacity. Like what Meng Yuan mentioned earlier, teleconsultation is carried out to remotely monitor patients. In this case, clinician utilizes telehealth to ensure that these COVID-19 patients who are staying in the virtual wards are given the appropriate level of medical attention. Under the virtual ward program, patients and their caregivers could measure patients' vital signs like their body temperature, blood pressure, and their blood oxygen level. And this data are monitored by the hospital team to spot early signs of deterioration. The implementation of virtual ward has helped NUHS save over 3,500 hospital bed days. Following its success, a similar initiative is now being trialed under MOHT for patients with other medical conditions and those who require post-operative care. This example that we have seen so far are more of a systemic nature, and we look at care delivery on the whole and make the systems-wide changes in the way we operate. Now, the next example I'm about to illustrate takes on a more individual slant. It looks at improving patient experience. We know that the quality of life has a direct impact on patients' condition. And nursing home has long been criticized for being over-medicalized and stripping the residents of their privacy. So in one of the recent projects that I've consulted, this team decided to do something to preserve the dignity and sense of identity of the seniors. So if you know that one of the first things the elderly has to do upon checking into the nursing home is to change into a set of uniform that's provided for. So in that very moment, the elderly lost a part of his or her identity to just being another patient on Ward X or Bed X. So this team wants to reverse that effect. Therefore, they started a pilot to allow the residents to wear home clothes in the nursing home. But very soon they realized that the challenges their initiative brought about. Using business process re-engineering techniques taught in class, they analyzed an existing process and identified problematic areas to work on in order to arrive at a solution. So here are the 3 areas that they have identified and came up with innovative solutions to tackle the problems. So first of all, they have to tackle the issue of clothes tagging so that it can be returned to the right owner after wash. So instead of depending on their in-house team to perform the tagging, which will often result in a bottleneck issue, they decided to outsource this job to the community tailor. The result is that instead of a 3 days turnaround time, the home clothing can now be tagged within a day and deposited at the resident's bedside storage cabinet. And this was done ahead of the resident's day, resident scheduled admission, and part of the effort to make them feel more at home. The next issue that they faced was more time is now required to sort the clothes, since they are no longer differentiated by just the sizing, but by individual. Now, the team has cleverly optimized the role of the vendor in assisting to sort the linen. Typically, after wash, the uniforms are sorted by sizes and returned in a big bag. Now, with the home clothing, they can't do the same. So instead, they have gotten the vendor to sort the clean home clothing into separate bags labeled by their level and cluster. So if you can see on screen, the cabinets and the trolley space are labeled. So they actually got the vendor to deposit the clean clothing according to the level and cluster, and thereby helping the team to save more time in sorting. And internally also, they want to ensure that the turnaround time to sort and return the home clothing does not exceed that when the residents were wearing uniform. So the residents, or rather the staff, came up with yet another simple but innovative prototype as you see on screen. Now, this divider separates a number of bed cubicles, and it allows the staff to sort the home clothing by bed more easily. Therefore, the team is now able to achieve more time saving in sorting and returning of the linen to the resident's bedside. So, if you compare the before and after implementation of their pilot initiative, this team has achieved an astounding time saving of 43.5% in sorting and returning of home clothing to the residents. Therefore, we want to illustrate to you that through all these examples, innovation can come in different shapes and sizes, and some are more systemic in scale, while others are at a more operational level. But crucially, at the end of the day, what we want to achieve is still better health outcomes and improve patient experience. As a practitioner, we are all too aware that health innovation is not without its challenges. So perhaps you can get Kim to share with us what are some of these challenges she encountered when doing innovation. Kim, please.
Thank you, Bethia. Yes, and in my opinion, it will be change management because we all know that innovations will transform the way organizations conduct businesses, and it also involves change. Change is constant, it involves people. Now, the reason for a change is because we want to achieve desired outcome. Now, this desired future state of the organizations can only be achieved when numerous individuals in the organizations shifts collectively. Now, change management is an enabling framework to manage the people side of change from current state to new future state so that the desired outcomes are achieved. In short, change management is the bridge between the solutions and the results. Now, Betty, would you like to add on this?
Yes, Kim, I cannot agree more. And with the changes comes resistance, and we all experience a great deal of resistance from people when they're under stress. So, as mentioned in the beginning, the increasing workload could be due to aging population or the shrinking workforce. And when faced with increasing clinical demands, innovation is usually in the back burner. We want to rely on the good old ways which we are familiar with, the one which we can be most efficient in to get our job done. So this can blind us to the long-term gains of innovation. Another huge challenge to innovation would be managing various stakeholders. So we often preached about the value in bringing in diverse stakeholders with different capabilities and functions so as to create a big impact. However, diverse stakeholders often bring conflicting motivations, perspectives, and approaches to collaborative, innovative projects, especially in their prescribed roles. So, case in points, designers often embrace quantity and the speed of generation of ideas with quick and dirty prototyping. But this wouldn't sit very well with clinicians who are more cautious, precise, and scientific in their approach to problem solving. So, try bring them to a compromise can sometimes be a challenge. Yeah, so Yuan, what in your opinions are the challenges to health innovation?
And thank you, Batya. For me, the big challenge is inaccessibility and unsustainability of health innovation, especially for the vulnerable populations. In fact, pharma and biotechnology companies often use a value-based pricing strategy, which benefits over social value. This market based consideration has limitations in terms of estimating the value of health, quality of life, and the cost of illness and death. Therefore, equity, responsibility, and the final aim of health innovation will be compromised.
Exactly. A common gripe we hear is that there's limited budget and the project doesn't yield returns fast enough. So venture capitalists of IT startups might see returns in 2 to 3 years, but often biotech companies may take more than 10 years to know if the product is being approved for use. So, on the other hand, you also have project sponsors who often desire breakthrough, transformative, or disruptive innovation. So, nothing wrong with that. But what they fail to recognize is that in order to come up with such transformative or disruptive innovation, it sometimes may mean that they have to support a longer than expected time frame required to show and deliver value. So, if we switch gear a little and look at innovation from a systems lens, we will start to see that there are many silos within an organization. And having a fragmented system means that no one has the overall end to end accountability of the outcome. So, for instance, if we look at the waiting time issue in the emergency department, we start to realize that inherently there are many silos in existence. So, the administrative staff taking care of registering the patient will not have the oversight of the patient once he or she goes to the nurse for triaging. And likewise, after the nurse triage the patient is left waiting for consultation with the doctor, which is yet another silo. So the reason why there are many silos is because of the way our job roles divide us. So we are bounded by our functional role. And while we're very good in what we do, we don't have the end-to-end view of a patient's journey to make changes both upstream and downstream. Meng Yuan, you have earlier pointed out that unlike other industry, the healthcare industry is highly regulated. So can you share with us some of these challenges in the area of regulations?
Yeah, thank you, Betty. Because of strict regulations and a desire to avoid causing unintended harm, innovations in health are often tested and adopted gradually. It is easy to understand, but it's also very time consuming. A part of innovation is to allow quick succession of prototyping and iteration. However, wary of the repercussion on clinical care, it allowed almost zero room for failure, which makes people feel fearful to attempt innovation. When we talk about regulations, it will never skip the topics of privacy and cybersecurity. So, Kim, do you have any insights of it?
Yes, speaking about the cybersecurity and privacy, when it comes to privacy and security have been a long hindrance to innovation. Now, in this digital age, we are dealing with enormous data from myriad sources. Hence, we need a robust cybersecurity approach that safeguards sensitive information and protect data from malicious cyber attacks. We also need a ubiquitous security infrastructure for seamless data exchange and preventing unauthorized access to data. What else? Another one, it will be a good enterprise data governance, which ensures the roles and responsibilities are clearly defined and the accountability of all stakeholders are agreed across enterprise. To you, Betia.
Yes, thank you, Kim. So in this last bit, we want to discuss on how we can make these innovation efforts more sustainable. So I'd like to start off by proposing a more human-centered innovation. That is, we focus on our assets and how to build up human capabilities in this area. So, first of all, as a patient gets more affluent, they increasingly want to be involved in making their own health decision. So, in creating new clinical pathways, we can consider maybe making these patients a co designer or a co developer to arrive at a collective health outcomes. One that gives them a sense of ownership, ones that resonate with them and ensure that they stick. So patients can identify the key pain points and test the solutions derived by the health practitioner. And this way, it makes our innovation process more robust. Now, the next point I want to make is to cultivate a culture of innovation because that is something that will influence the behavior of staff subconsciously. We want to ensure that even with the change of leadership or constant turnover of manpower, it will not depreciate the innovation spirit or efforts that were already underway. So, how do we build this culture of innovation? So, although I must admit that changing people's mindset and making it a way of life is no easy feat, but rest assured that the results will be truly rewarding. So, I'd like to propose three practical steps that we can take in order to build this culture of innovation. So, first of all, it's by promoting freedom at work. I don't mean lawlessness and staff can do whatever they want now, but rather leaders should move away from simple delegation to empowerment. Then this would mean forming autonomous teams with members with different skill sets and from different functions. And they could be empowered to make decisions for projects that they are working on. And in this way, it can lead to greater trust and productivity. My next recommendation may sound a little audacious to staff, and is to allow staff to take risks and also to make room for failures. And these failures should not be career limiting. So, just to be clear again, this is not license for recklessness or sloppy mistakes. Rather, it's allowing staff room to dream up innovative ideas and testing them while carefully considering risk and accepting margins of failure. We can do this by creating sandbox environment in our organizations for staff to test out solutions. And the staff can also use small pilots to test and iterate. Now, only when they are sure that the results are positive should they then proceed to scale up. I think many hospitals in Singapore are now equipped with innovation labs to allow staff to do some of this innovation work. And I think this is the way to go. Okay, now lastly, let me swing back to something that Kim has mentioned earlier on change management. We all know that change is not easy, and organizational change is best implemented when there is plenty of willingness to change at a personal level. So, for this to happen, our leadership has to take the lead by example. By this, I mean, don't give people the impression that when change happens or when certain plan is implemented, it is done. So our role is to ensure that they realize that there will always be more and more change. So while as cliche as it may be, change is the only constant. And that way we create a healthy appetite to change for our staff. Okay, now it has been quite a mouthful. So let us hear from Meng Yuan how she thinks healthy innovation can be made more sustainable.
Good. Thank you, Batia. As altruistic as we are, nobody works for free, and hospital depends on fundings to keep operating. Nothing shapes up the industry as much as a change in the healthcare financing model. Here, we are referring to the change in fee-for-service model to capitation model. Each of Singapore's 3 healthcare clusters will get a fixed fee for every person in the geographic region under their care, regardless of whether they are healthy or not. Each is expected to look after up to 1.5 million people. This creates an incentive for clusters to make sure their residents stay healthy through preventive care, so they will be able to keep the money that might otherwise be used on costly treatment. Nowadays, healthcare professionals are putting into a more proactive view to keep the population healthy. This drives the need for innovation to provide greater value and better care for individuals. With a value-based care model, institutes have to refine their own process and work with other organizations in the wider healthcare ecosystems to deliver better care. It also means streamline of clinical and business process while driving outcomes and controlling costs. This transition to value-based care model requires us to rethink of inbuilt process. So Kim, what's your opinion?
Thank you, Meng Yan. Yes, in my opinion, it will be the data and technology because we all know that data and technology actually improves, can also actually cause disruptions in the healthcare delivery as it changes drastically the way we work. We already see that in the form of teleconsultations during the pandemic, that even an industry as stringently regulated as healthcare can innovate rapidly. Now, to keep the healthcare innovation sustainable, we foresee greater leverage on technology and data analytics as they become more integrated and accessible in real time. Now, our common gripe is that research takes a long time before the innovations can be adopted. With technological improvements, research will be easier to achieve and more efficient, which will help healthcare organizations test new innovations more rapidly and to build up evidence they need to incorporate them into the patient care model. Technology and data will be the two key ingredients in our secret sauce to creating the innovations that move modern healthcare forward as healthcare leaders look for ways to solve more complex health challenges. There is a strong need for health system integration between the healthcare system, government, and other organizations to bring together digital functions and processes which used to be separated. Advancements in electronic medical records and other technologies are also helping to achieve medical interoperability among payers, providers, and other healthcare ecosystem players. Now, with the shift to capitations funding model, where there is a greater emphasis on preventive health and managing the illness in the community, it calls for closer working relationship between the hospitals and GPs. Therefore, the advancement in EMR, as mentioned earlier, would certainly help to deliver a more seamless care delivery. To ensure the healthcare innovations remain sustainable, we need to leverage on newer technologies such as artificial intelligence, AI, mobile technology, analytics, and cloud to take away the mundane regimental tasks and allow us to focus on roles which only human can perform. This will also free us up to prioritize our efforts for innovation. I'm going to give you another example. Kaiser Permanente, one of the largest hospitals chain in US, operate 39 hospitals with more than 87,000 physicians and nurses, is currently exploring to use AI to cull through nearly 1 million of medical records, including echocardiograms, and help to identify patients with aortic stenosis and other chronic heart conditions to support the work of researchers. To you, Betty.
Thank you, Kim and Meng Yuan. That was truly insightful. So you have heard us spoke about elements of process innovation, digital transformation, and also design thinking. And these are the courses that we're currently offering at Smart Health Leadership Center. They are stackable, meaning you have the freedom, or rather you have the flexibility to take up these modular courses in your own pace and time. So collectively, they make up professional certificate in health service innovation. If you'd like to learn more about it, please log on to our NUS ISS website under Stackable Program or simply scan this QR code. All right, so we have one question here that says, how do we sign up for the course? All right, so how do we sign up for the course and is there any subsidy? So if you're referring to the professional certificate in health service innovation, you can actually go back to, we can actually send you the link and you can sign up via our website. Alternatively, there is also a Queen Bee program under the Queen Bee program where we will be teaching you process innovation, a process in process innovation. So intermingling with design thinking, digital transformation, and also business process reengineering. We can help to improve your work process and also your current workflows in your organization.